most people know, but just in case, Sacituzumab govetican, it used to be called mU132, is an antibody-drug conjugate whose target is Trop-2. The antibody conjugate is linked to SN38 as the payload. Trop-2 is generally overexpressed in a number of different epithelial cell types, cancer types, approved for breast cancer and urothelial. So anyway, that's the study drug. The TROPHY-U01 study is a phase 2 study in multiple cohorts, actually up to 6 cohorts now, but the completed cohorts, cohorts 1, 2, and 3, are SG alone or SG plus pembrolizumab. So SG alone in cohort 1 and 2, and SG with pembrolizumab in cohort 3. Trop-2 is the target of this, so it made sense to let's go back and look at expression of that target and assess that with outcome. Outcome meaning objective response rate, progression-free survival, and overall survival. So there's archival tissue obtained in the majority of patients. So this looked at around 140 patients, which represented 71-72% of the overall cohort 1, 2, and 3 combined. Importantly, the baseline characteristics of the 71 or so percent that we had were identical, more or less, to the overall treated cohorts. We looked at expression of Trop-2 by immunohistochemistry, looking at two different methods, H-scores, which I think are a little bit more standard, and then percent of cells across fields. There was high correlation with the two methods, so really H-scores were what was used for the analysis, and the bottom line is that the vast majority of the tumors, urothelial cancers, had high level expression, so very few with low level expression, and across low, medium, and high, whether it was by median, which is in all the analyses, or by tertiles with one of the analyses for time to event endpoints, there was no difference. So there were responses with similar progression-free survival and overall survival regardless of Trop-2 expression. So whether that is because urothelial just kind of uniformly expresses Trop-2, or maybe based on the construct of the ADC, which is designed to release a little bit early, whether there are other factors, such as genomic, that are more associated with the outcome to that drug, we shall see. But this does validate some prior studies that show that our patients with advanced urothelial cancer generally express Trop-2.